So hello friends, welcome to Quick Learning Bites at DocTutorials. So today's Quick Learning Bite in ophthalmology is about a very important sign, the double ring sign. So let's have a look first at the sign. Now guys, can you appreciate that within this optic disc you can see one ring here and the second ring is this one, isn't it? So when you see this, you call it double ring sign, that this is characteristically seen in hypoplastic disc or hypoplasia of disc. Now, the outer ring suggests that this is a junction between sclera and the lamina cribrosa, the normal one, and the inner ring is actually the abnormal extension of RPE with the outer portion of your lamina cribrosa. Okay, so these two rings are your outer and your inner ring. Now, why do you have this ring? What is the cause? So it is mainly related to your low maternal weight, where you can also have a young maternal age, maternal diabetes, a preterm labor, or any complication during the delivery. Right. Now, is it dangerous? So guys, it can present as an isolated anomaly, but yes, it can be associated with dangerous things like midline structural cerebral defects, which is agenesis of corpus callosum, absence of septum pellucidum, and this is seen in a very important syndrome called as de Morsier syndrome, where you have septo-optic dysplasia. It can be having an association of pituitary gland abnormalities. So guys, this is a picture which I want you to be understood. So here in the left side you have a hypoplastic optic disc, right? And this can be seen in imaging as small optic nerves, and you have a hypoplastic pituitary stalk, right? And in this picture you will actually see that there is absence of septum pellucidum. You can be given a question where there is a double ring sign and absence of septum pellucidum. So you have to diagnose what exactly is this. So thank you very much. I hope you learned something new today.